We will now demonstrate tracheal suctioning. Verify the practitioner's order. Gather necessary equipment. Oxygen source, handheld resuscitation bag with tubing, suction apparatus, collection container, connecting tubing, suction catheter kit, 1 liter bottle of normal saline solution, disinfectant pad, stethoscope, blood pressure monitoring equipment, pulse oximeter, highly recommended gown, and mask with face shield. Preparing your equipment. Place the suction equipment on the patient's overbed table or bedside stand. Position the table or stand on your preferred side of the bed to facilitate suctioning. Attach the collection container to the suction apparatus and the connecting tubing to the collection container. Label and date the normal saline. Attach the handheld resuscitation bag to the oxygen source and make sure it's readily available. Implementation. Perform hand hygiene. Confirm the patient's identity using at least 2 patient identifiers.
Could you please tell me your name and date of birth, sir?
Ted Stillman, 1/1/71.
Assess the patient's vital signs, breath sounds, and general appearance, and observe for copious secretions to establish a baseline for comparison after tracheal suctioning. Attach the patient to the pulse oximeter to assess oxygen saturation before and after the procedure. Evaluate the patient's ability to cough and deep breathe to help move secretions up the tracheal bronchial tree.
Ted, could you cough and deep breathe for me? Good.
Explain the procedure to the patient even if he's unresponsive. Tell him that suctioning usually causes transient coughing or gagging, but that the coughing helps to remove secretions. Continue to reassure the patient throughout the procedure to minimize anxiety, promote relaxation, and decrease oxygen demand. Put on a mask with face shield and other personal protective equipment as appropriate. Unless contraindicated, elevate the head of the bed at a 30 to 45 degree angle to promote lung expansion and productive coughing and to prevent aspiration. Remove the top from the bottle of normal saline solution. Using strict sterile technique, open the suction catheter kit and put on the gloves. Using your dominant sterile hand, remove the catheter. Keep it coiled to prevent it from touching a non-sterile object. Using your non-dominant hand, pour normal saline into the disposable sterile container. Using your non-dominant hand to manipulate the connecting tubing, attach the suction catheter to the tubing. Using your non-dominant hand, set the suction pressure at 120. Higher pressures don't enhance secretion removal and may cause traumatic injury. Occlude the suction portal to assess suction pressure. Dip the catheter tip in the normal saline solution to lubricate the outside of the catheter and reduce tissue trauma during insertion. With the catheter tip in the sterile normal saline solution, occlude the suction control valve with the thumb of your non-dominant hand. Suction a small amount of solution through the catheter to lubricate the inside of the catheter, which facilitates passage of secretions through it. Note patient's vital signs. Continue with procedure if vital signs are stable with an SpO2 of 95 or greater. Using your non-dominant hand, disconnect the patient from the oxygen source. Using your dominant hand, advance the suction catheter gently to the pre-measured distance needed for insertion, generally the length of the tracheostomy tube, without applying suction. Measuring the depth ensures that the suction catheter doesn't extend beyond the end of the tracheostomy. After inserting the suction catheter, apply suction intermittently by removing and replacing the thumb of your non-dominant hand over the suction control valve. Simultaneously use your dominant hand to withdraw the catheter as you roll it between your thumb and forefinger. This rotating motion prevents the catheter from pulling tissue into the tube as it exits, avoiding tissue trauma. Using your non-dominant hand to stabilize the tip of the tracheostomy tube as you withdraw the catheter to prevent mucous membrane irritation or accidental extubation. The suctioning event should take no longer than 15 seconds. Resume oxygen delivery by reconnecting the source of oxygen. Observe the patient and allow him to rest for a few minutes before the next tracheal suctioning. The timing of each suctioning and the length of each rest period depend on the patient's tolerance of the procedure and the absence of complications. Encourage the patient to cough in between suctioning attempts to enhance secretion removal. Patient's vital signs should return to pre-procedure levels. Clear the connecting tubing by aspirating the remaining normal saline. Remove your gloves and other personal protective equipment and discard used supplies in the appropriate receptacles. Replace supplies as needed. Perform hand hygiene. Maintain the head of the patient's bed at a 30 to 45 degree angle if the patient's condition allows to prevent pneumonia. Osculate the patient's breath sounds bilaterally. Assess the vital signs and monitor the oxygen saturation levels to assess the procedure's effectiveness. Perform hand hygiene. Clean and disinfect your stethoscope using a disinfectant pad. Perform hand hygiene and document the procedure.